Thank you everyone for joining. Great to be here. So I'm the founder and CEO of Immersive Rehab, and we're essentially a digital therapeutics company, and we develop digital therapeutics for neurorehabilitation. So we use virtual reality to change the way rehab is being done, in particular rehab for people with neurological conditions. The reason why I started the company in the first place is my own experience going through rehabilitation. I had a severe work accident 10 years ago, and this is me 6 months apart, essentially in early 2010 and late 2010. So I had a severe work accident. I went through a long rehab period. I lost a lot of my mobility. Essentially, I had very bad balance for more than 2 years. A spinal injury as well, and luckily I was never paralyzed. So so going through that rehab period often left me very frustrated and isolated in the way rehab was being approached. Also the engagement of exercises, and also the information that you get back as a patient in terms of how you're evolving essentially from day to day or week to week, is currently very limited, and often you're graded on a very subjective scale base. One day they might say you're a 7, the other day they might say you're a 5, but it doesn't really mean much. And so it really really makes rehab not a very motivating experience to go through. And I'm a biomedical engineer and scientist myself, and so I went to look into, I started looking into potential solutions to change the way rehab is being done, to make it more engaging, increase assessments in a more objective manner, and also towards how patients are understanding it better. And so I started to look into different conditions as well. And currently, I was looking into neurological conditions in particular. And if you look at the current state of those for those patients, and then especially the problem that they're dealing with, is basically, when you look at MS, the average age of MS patients is 30 years old, and it's 3 to 1 women versus men. But that means at 30 years old, all these people have very active lives, whether it's professionally or personally. And when you get a diagnosis that you will most likely start to lose your mobility in a fairly, hopefully, depends on what the condition is, especially with MS. It is a very, very hard diagnosis, and then on top of that, when you don't have access to rehab that is motivating and engaging, and then also initially you have a lot of access, but then gradually the access reduces, especially when you get out of the hospital or in your community where you live, the access might be very difficult. And the same goes for stroke. I mean, obviously, stroke incidences are very high every year, and they're only increasing every day. And if you look worldwide, there's about 50% of stroke patients have a remaining disability. And a lot of that is focused on upper limb problems. And so that's really where we focus on as well, is upper limb mobility. But the problem is that a lot of these patients, they don't have, and the clinicians and the therapists, they don't have the tools to help their patients in a really engaging manner, and also to achieve the gains that they want to achieve within the time frame that they have access to rehabilitation, for example. And that's really where we started to look into, is there really something that we could use from a visual representation perspective, visual simulation perspective, to help people unlock the potential that they have in their bodies to actually regain more mobility. And seeing that, for example, a lot of the patients, they cannot engage with larger objects, and even smaller objects, they really struggle because they don't have fine motor skills, for example. But in VR, you could actually bring people into these virtual worlds where, one, you can make it really engaging, where people don't think about what they're doing. In terms of repetitive movements, where now it's do 20 times this, lift 20 times your arm like this, and then you don't really see the point. And that's why compliance and gains are incredibly low within, especially upper limb rehabilitation for these type of patients. But in VR, obviously, you can really make these exercises in a way that they are engaging, they are motivating, they're challenging as well. And the exercise that currently are being done, you can recreate those, but using objects is actually, and that's essentially what your brain wants to see as well to recover. Because if you do a certain movement, but you don't interact with objects, essentially your brain does not link that movement anymore with a certain object. And that's really the power of what VR can do, and how we can help restore mobility for patients, hopefully in a better way than that they currently have. So when we compare rehab today and rehab, it is very basic. This is like wooden pegs that they have, that they ask patients to put in certain holes. One, they're very basic tools. They don't give any feedback. So you, as a patient, you don't really see progress. You don't really understand what the value is of these exercises in the same extent as you would have when you get a lot of data back about how you're progressing, etc. Also, these exercises, we mainly work with adults. These exercises are really very, they look like children's toys. And obviously when you're already going through a very hard condition, and then you have to go through very demotivating exercises, it does absolutely not help your condition. And a lot of the patients we work with as well, they struggle with mental health issues because of their condition and so on. So that's really why we need to change the way we have in this particular case and is being approached. And especially also to help the therapists and the clinicians to help their patients better. So we work very closely with therapists and clinicians, so neurologists in particular, to help improve the help that they offer, and to help improve their toolbox that they can offer to the patients that they work with, both in a clinic and in a home setting. So this is one of our exercises. I sadly can't show a video at this point, but essentially this exercise is based on something that is called the grasping method. So it's essentially, you would do rotational movement, reaching, grabbing. But today, the physios and therapists, they don't use any objects because they know how frustrating it is for patients. Also, they can't engage with large objects anyway. So, but here you can actually do very similar movements, but we mix it up, and we give people a challenge. So you have to complete a challenge within a specific time, depending on your difficulty and on your condition, essentially, as well, what you can do within a specific time frame. And that you could see immediately that patients don't think about the repetitiveness of exercises because it's all mixed up, but they're still doing this amount of exercises, but they're just looking at, this is the goal and this is what I need to achieve. And it's incredible then to see what happens to their concentration, also their movement range and so on as well. So, and the patient you see there is actually a Paralympic athlete who had a spinal tumor, and he was paralyzed 4 times because of the spinal tumor. But here now, essentially, he was helping us as well to give us feedback in terms of the visual stimulation, because his upper limb was affected like a stroke. And he still was struggling with one part of his arm in terms of mobility training. And he was using visual stimulation already before we actually met constantly to help him recover and help Keere have those marginal gains in his recovery as well. So as I mentioned before, obviously, so we focus on bringing this in the hospital, and that clinicians and therapists can use it with their patients in an acute setting and in an outpatient setting, but also to bring it into people's homes upon referral. So basically that a clinician, that all the data, whether it's in a community setting or whether it's in a home setting, that data that a patient, that the system is collecting from the patient while they're going through these programs is being sent back to the therapist or the neurologist, and they can then see how a patient is progressing. And they could tune in as well remotely if necessary to see how they're progressing. And because patients have already been using then the system in the hospital, then the second stage is to bring it into a home setting when they're already used to actually using the system. And it's not like a very new thing that they would struggle with using in a home setting then, or with their carers or therapists coming in a home setting. And that's really very critical. It's both that data collection in the clinic and in the hospital setting, and the data collection in a home setting to really give a much more informed report, I guess, about how a patient is evolving within their rehabilitation. Where now what the problem is that for example, a stroke patient, when they would have a stroke, they go into the hospital, they are going through rehab between 4 to 8 weeks, depending on the country that you're in. And then they leave the hospital, and that's often it's because there's again long waiting times, or depending on where they live, they don't have access. And so there's a really a massive gap in both kind of areas of rehabilitation that we're trying to address here. And obviously with COVID, the issues that existed before, they've just been amplified significantly, sadly, for most patients. So that's really a big problem at the moment. So this is really our vision. Is you can imagine today immersive rehab is not there. Patient data exchange, very, very limited or non-existent in most cases. So that's really what we want to improve. We want to plug it into the clinic, bring it into a home setting, and ensure that there's a lot more data collection both in the clinic and in the home setting that is then, for example, sent back completely to the clinician for follow-up meetings, etc., and really get an informed understanding of how patients are progressing. And this is in particular important, I mean, for all the conditions we work with, but so we focus on MS, stroke, spinal injury, and motor neuron disease for the moment. And you could classify those two already in stroke and spinal injury, which are more abrupt conditions. And then the other ones are neurodegenerative conditions, which is MS, multiple sclerosis, and motor neuron disease, or ALS, which obviously they progress gradually. So that's the kind of the two groups that we work with, but obviously have very different needs and very different. There's symptoms obviously that are overlap. There's lots of overlapping issues, but there's also very significant differences between those, and that's really what is important in terms of approaching these type of programs to make sure that they are, and now I'm going to the next slide, they are personalized essentially to the conditions and ideally to the patient, because every condition for every patient is different. And what is happening today is often there's much more generic programs that are being given to patients, and that is because of the lack of time, the lack of resources, the limited rehab time that people have. They just can't personalize exercises from a clinical perspective for patients. They just don't have the resources and the time to do it. And then that is really just problematic for the clinicians and the therapists themselves, because it's not that they don't want to, they just don't, they just in most cases cannot do it. And that's really what we want to bring as well, and to ensure that we can help personalize those exercises more, and also then target it towards specific conditions, and help with more objective patient assessments than both in the clinic and in a home setting. So currently we are still going through clinical validation in various regions of the world. We currently focus on Europe, the US, and Canada. We also have conversations ongoing with other regions in the world, like Brazil and South Africa and India. And and that is really critical, because essentially we are a healthcare company. We are a medical device as a solution. So we are a therapy. That means that we need regulatory approval to actually get it into a clinic or being used in a home setting, because we use it with people that have injuries, and with people that have patients that have medical conditions. And that is really what our approach is to our development of our programs. We develop the programs as such that they are there to enhance the treatment that people have, but they are not there to do any harm to the patients. So because of that reason, we approach it very much from a very highly clinical and scientific perspective, to ensure that we do no harm essentially to any patients within their whether they are treated within a home setting or within the clinic. And yeah, so that's really what we're doing at the moment. So please follow us on social media and have a look at our website. And yeah, I look forward to now coming back to your questions as well. So I see we have one question. So have you included finger hand tracking solutions and how do you think a very reliable solution will impact the procedure? So we are currently using, we have used Leap Motion and some other finger tracking, and that is kind of the current approach that we're taking in terms of, because obviously finger tracking is really important, and also the interactions with the objects. And over the past years, that has increased significantly. I mean, the first time we've used Leap Motion almost 4 years ago, and then now it's improved significantly. And other, obviously, hand tracking integrated within headsets, etc. They are improving every day, and I think that has been really critical in terms of having a really good experience with patients in particular. So that we use both. So we use both controllers. So we use the Vive, for example, with controllers, but then also we use Leap Motion for hand tracking with the Vive, and then we've used hand tracking within other headsets. But because of obviously the hand tracking is very critical in just in terms of, especially because we focus on upper limb rehab and fine motor skill training, so you have to have a really good interaction with objects. So that's really critical, yeah. And then Carl has a question. Sounds like VR is driving engagement in the physical world, addressing motivation. Would it be fair to compare this to gamification? I mean, we definitely, we are not a game company, just to clarify that. We are a healthcare company, but we use, obviously, principles of gamification in our development of our programs. For example, commercial games would not be suitable for patients for various reasons around interaction, speed of game, etc. The way the game was being approached would actually make induce certain negative symptoms within a lot of patients. So, but the way we obviously approach the engagement part of games and challenges and incentives and having certain visual cues as well is obviously, yeah, absolutely, that's definitely coming from the principles of gamification, yeah. Carl, so have you given any thought to the impact of the virtual world on not only the motivation, but of the result of the activity? Let's say the user lifts a virtual kettlebell, could making it appear heavier or less heavy have an impact on the result? Yeah, I mean, obviously there are some interesting studies actually on this already as well, from Stanford, the Human Interaction Lab, where they've, for example, enhanced, you, for example, do a movement and then they enhance your movement, but actually your hand is still here. But in VR, they enhance where you actually are, also within a rehab environment study that they've done. And obviously it will work on your psyche. And in our case, just going back to the heavy and light weights. So, for example, you saw the block exercise game, and so or program, we've approached it in such a way that the blocks are very spongy and they're very light. They have a light feeling. So coming back to your feeling of being in the virtual world, when you are picking up this object, because of the way that we chose the material for the blocks, it just feels naturally light. And the way you would interact with it, and when you push another block on another block as well, you just know that this cannot be a heavy block. And it's funny because when people come out of the experience, they say, oh, the blocks are so light, while they don't have any weight, etc. So it's very interesting how you can, by using certain visual without using any haptics, because haptics today are not, they need a long way still to go before they're actually really practical, especially within a clinical setting. But so you can actually play around with other visual cues, audio, for example, in terms of certain interactions, to actually just give a representation of touch, of kind of how heavy objects are, etc. So it's very interesting to see how those interactions, after the first try already, how people are perceiving. And that is obviously really important in having people stay in the experience as well, and assuring that they would just continue doing exercises and yeah. And also in our case, the reason obviously why this was a specific choice was of the lightness of the blocks, for example, was just to give people also a sense of safety. Because if you build a high tower, for example, but suddenly the because it's a lot around coordination in our case as well. So our programs work around coordination as well. So, but obviously patients really struggle, and then it's the training of their coordination. And let's say that the blocks have not been stacked properly, the risk is that they would fall. But because of this light sense of the blocks are very light, it doesn't matter if they fall, so it still gives a sense of safety. Versus if you would have this giant, I don't know, concrete wall that would suddenly fall, it would just provoke something very different in your mind. Yeah. So. Yeah, so I'll just go to Greg first. So does your solution envision to change the golden standards for patient status progress assessments? Yeah, I mean, obviously we are working very closely with the clinicians and the therapists to ensure that we achieve a level of treatment that we have golden standards for treatments. That's why obviously the clinical trials are really important to ensure that we really are there to help improve patient outcomes. That's the most important thing. The most important thing is to deliver the highest possible quality of assessments as well, because obviously assessments, we are informing clinicians or therapists in their decision-making for further treatments and for further, for example, changing of drugs for patients with neurological conditions, like neurodegenerative conditions like MS. If we don't do that in the correct way, this will impact the life of patients and the health of patients. And that is coming to Carl's question as well. Safety of patients is the most important thing. And so ensuring that the assessments as well are done in the most high quality level is really critical and important. So as Carl said, safety seems like an important aspect. I was thinking about the mind-body connection. There has been some studies about muscle gains and imagination. Imagination could be a powerful tool. Okay. So I mean, it is please if anybody else has any more questions. But it is, imagination, especially within VR, is a very powerful tool. And if you look at the patients we've worked with so far, just for them going in this environment that is not a clinical environment, and also and that is really coming from my own experience as a patient, is that the first time I was able to go out on my own independently again was the most incredible experience. And that's really what we want to bring to patients as well. Just even if it's just pressing one button in the virtual environment to start the program, where the clinician, for example, especially in the initial phases, would just set up everything and they would just need to press something. The fact that they are actually pressing something or doing something and activating something within the environment is giving you a sense of, I'm taking charge of my own rehab, I'm taking charge of my own recovery. And yeah, so that has been really important. Even if the physio is still helping them and supporting them, etc., the fact that they can actually take charge in that environment has been incredible. We've worked with a patient which, it was they had just had a stroke. They hadn't been out of their wheelchair since the 2 weeks ago that they had a stroke. They came to us, and so essentially when they were trying, initially were, I'll do it, but it's because the physio has asked me to do it, and you could tell that the person was incredibly down and having it mentally incredibly hard after his stroke 2 weeks ago. And he also had a speech impairment, and his upper limb, like one side was affected, and he was having severe balance issues because of his stroke. So he was in his wheelchair. And so when he was doing our exercises for the first time sitting, so we have a sitting and standing option. And that is really important as well because of the conditions we work with, that we offer both, and accessibility in our solutions is really important. So when he was doing experience first, he was doing it with the affected side, and you could just see already how he was transforming within this first try of doing this experience. Let's do it again, and let's see what I can do further. And then he said he wanted to do it a second time, but doing it standing, knowing that okay, he would need help from the physiotherapist and the therapist holding him from the side just to be able to stand up. But he said, I want to see what it does to my balance using my good arm now and see how it can train my progress. And yeah, again, he had not been out of his wheelchair or his bed since the stroke, and then suddenly he wants to take that opportunity to, I want to stand up, I want to see what it does and what I can actually achieve within for the future again. And I guess it's really about giving patients hope and options and seeing it. Well, there are things that possibly can help with the help of also the interaction. What was also very interesting within this interaction is that you could tell that the interaction between the patient and the physio, that the therapist was not good. I guess you could feel that it was very tense and stressed, and which is obviously normal. But then when they were doing it, they were laughing with each other, and because they were kind of just experienced something together. Yeah, it was very empowering to see. Yeah, so yeah, if there's no more questions, otherwise, yeah, I mean, feel free to connect with me on LinkedIn or via social media, and then to follow the journey as well. So.